This is the Implementation Science Interest Group monthly meeting. So please note, everyone, that this session will be recorded and the recording will be made available on the Australian Institute of Health Innovation website. We have a presentation, but please use the chat function to post your questions. And we hope to have an interactive session at the end after Matt finishes the presentation. So please just unmute yourselves at the end and ask questions. It's really nice to be interactive and to be able to talk together. All right, so it is my great pleasure to introduce Dr. Matthew Chinman, who is an implementation scientist at the US Department of Veterans Affairs and the RAND Corporation. Matt is a clinical community psychologist and research scientist at the VISN-4 Mental Illness Research, Education and Clinical Center at the VA in Pittsburgh, and a senior behavioral scientist at the RAND Corporation. He is also the director of the Implementation and Evaluation Core in the VA HSR&D Center for Health Equity Research and Promotion, CHERP, at VA. So we're very, very pleased to have Matt on board with us tonight. Tonight for Matt. He's coming to us from Pittsburgh, and it's really wonderful to have you on board, Matt. Matt's going to be talking about implementation science, revision of the Consolidated Framework for Implementation Research. And many of you would have seen the latest publication from Laura Schroeder late last year with the revision of the CFIR. But before we get started and hand over to Matt, I will move my slides on, I hope. And acknowledged country. So we acknowledge the traditional custodians of the land on which Macquarie University is situated, the Wallumattagal people of the Darug Nation, whose cultures and customs have nurtured and continue to nurture this land since the dream time. We acknowledge the traditional custodians of the various lands on which you all join today, and the Aboriginal and Torres Strait Islander people participating in this webinar today. We pay our respects to elders past, present and emerging, and celebrate the diversity of Aboriginal peoples and their cultures and connections to the lands and waters. Okay, so I will stop sharing now and let you share, Matt.
All right. Zoom quit on me again, so
Quit on you. How about I share your slides and you talk to them? So you just tell me when you need me to move on.
I changed a bunch of slides, so let me try again.
Okay. Yeah, that's good.
Okay.
Can everyone see that? Yeah, perfect. Okay, wonderful. Thank you so much, Matt. Go ahead.
All right. Well, thank you so much for having me. This is a lovely opportunity to talk to you all. And just really excited about CFIR 2.0 or updated CFIR. It's been different names, people are calling it different names. And so today we're just going to talk about, advance the slides, sort of a very brief overview of what is CFIR, and then spend most of the time on how it's changed from 1.0 to 2.0. And then after that, I'll be curious to hear about how you all are thinking about the new addition and, maybe what kind of implications it has for your own work in implementation science. So what is CFIR? So CFIR, or the Consolidated Framework for Implementation Research, we call it a sort of a meta-theoretical conceptual framework. And the meta is because it incorporates a whole bunch, 19 different theories, models, framework, from sort of classic theories like, Rogers' diffusion of innovations, the Stettler model, Green Law, Ottawa model of research use, many different models, and it pulls all of those together. And Laura and her team had a review when they put the first one together of over 500 published sources, multiple disciplines, and so it's really become like this one-stop shop for all these great theories into pulling the one model that rules them all, sort of. And it's really been developed to help users understand which factors may influence implementation of an innovation. And that sort of conceptualizes CFIR in a nutshell. So, like implementation science itself, CFIR helps address many different factors, linking an evidence-based practice, or an EBP, to outcomes. And so this is a model from Enola Proctor, another sort of well-known implementation scientist, that tries to show how implementation science kind of bridges the gap. So what the usual state of affairs is you have some practice or intervention, something we call an innovation. And then there's some research that's done to sort of see what kind of impact that has on patient outcomes. But that's sort of ignoring a lot of different factors. And so what are kind of implementation strategies that might be used to help get that intervention in place? And so that could have a big impact. What are the implementation outcomes? Sort of feasibility, fidelity, penetration, acceptability. These are also from Enola. These usually are precursors to patient outcomes. And then also service outcomes, things like safety, equity, patient-centeredness. So all of these are the purview of implementation science, and CFIR has a big role to play in that. So CFIR, as you may know, has been hugely influential in the field. It just recently reached over 1,000 citations since coming out in 2009 in implementation science. It's usually in the top 10 articles cited every year since implementation science came out. So it's been very influential, and I think a real boon for implementation researchers and scientists to be able to provide all these different factors that influence implementation. It's really helped kind of standardize the language. So this is CFIR 1.0. You may have seen these before, but as we know, there are 5 key domains. Those 5 domains are still the same domains pretty much in the CFIR 2.0. So characteristics of the intervention. So that's now going to be changed to innovation in 2.0. But these factors come really right out of Rogers' diffusion of innovation, the evidence strength, the relative advantage for the intervention, how adaptable, triable, complex, how much how it was designed and the quality of that. And then the inner setting, this is the place where you're going to be implementing your innovation, and all sorts of characteristics about that. The inner setting, it's culture, communications, climate. And then the outer setting, the big sort of the world out there that surrounds the inner setting. And then Laura and her team talked about sort of patient needs and resources, the understanding of that, how cosmopolitan the sort of the culture around the inner setting is, any kind of peer pressure, incentives and policies, and then the individuals involved in doing the actual implementation. So what do they know, how efficacious they are, how well they identify with the organization, their individual level of change, stage of change, other attributes, and then an implementation process. So like the actual plan, the doing of that. And so, that's things like planning, engaging, executing. So this is CFIR 1.0, and again, hugely helpful for implementation science. So how has CFIR changed? So first, the sort of the methods and motivation for what led to the change. Laura and her team did a huge review of the literature, over 375 articles, 59 of which included specific feedback on CFIR. So like, say in a discussion section, where the authors said, we think CFIR could be improved by X, Y, and Z. And then, so that was a big source of data for changes. And then also, they did a survey of implementation scientists. About 40% of the folks that were surveyed also completed that survey on all sorts of questions about what was clear, what was not clear. And most of the surveys came back, with a lot of positive ratings. But there were some feedback on what should be changed. So the big conceptual changes, or sort of three buckets. The team there wanted to really make it clear that it's really the perceptions that of the people that you typically talk to and get the information you need to make CFIR ratings, and that it's really just all perceptions. Often we say like perception is reality, but it is still the perception that is driving how CFIR determines how a certain factor could be a facilitator or a barrier. Also, there's a lot more emphasis on trying to be clear about the dividing line between sort of the inner and outer settings. And then the last one is when you see the new one, that'll become clearer, but the old one had any mention of people in all of this were sort of scattered across all the different domains. And now all the mention of people are really consolidated into the individual domain. And I think that makes it easier to kind of get your head around, a little bit more conceptually clear. So these are some of the kind of the big ticket item changes. And we'll get into each domain and sort of the specifics for all of that. So CFIR 2.0 sharpened some domain definitions. So I don't know if folks are familiar with Jeff Curran. Jeff Curran, he was the lead author on all the hybrid, the paper that introduced all the hybrid designs. But he also recently came out with almost sort of a funny piece about trying to talk to non-implementation scientists about implementation. And it was all around this idea of the thing, like the thing that's going to get implemented. And so that language is catching on, I guess, in the States. So, but here, instead of intervention, it moves to innovation. And so this is the thing that is being implemented. And what are, some of the key question is, like, what are the perception about its properties? That's really what we're concerned about in the innovation domain. Individuals, who are the individuals most likely to influence or have authority over implementation? So not only are individuals all consolidated here, we actually broaden out the range of individuals that you might want to talk to and get information from as you are sort of doing interviews and collecting data to kind of round out what the perception is of the implementation effort. The inner setting is where the implementation will occur, from where will the innovation be delivered? That's the key question. And then the outer setting and the setting in which the inner setting exists, a little tautological there, but so the idea is to really kind of come up with a very and push sort of the sites that are doing the innovation to really get clear on where does the outer setting begin. For example, so in the VA, where we have an integrated, the United States VA, where we have an integrated health system, a clinic within a hospital, the clinic could be your inner setting, and then the whole hospital could be the outer setting. Or in some cases, maybe the hospital could be the inner setting, and the whole VA system could be the outer setting. So it can really vary, but it's really important to kind of get clear on what those are. And then lastly, process. To what extent do certain roles that get spelled out in CFIR do the actions necessary for sustained implementation? So just a word about the word innovation. So I know innovation often means, it does mean something new, right? And so CFIR does concern itself with a practice or a clinical intervention that is completely new to a system, but it also concerns itself, and very often we see this in the VA a lot, with a practice that's actually not new, but is just sort of not being implemented the way everyone really wants it to be. So it's like on the books, people know about it, but it's maybe limping along. It's sort of underperforming. And so sometimes an implementation effort will get organized to make that practice better, rather than completely introduce a brand new practice that has never been done before. And both of those things are really considered innovations here in CFIR. So just an example of sort of what we mean here for using or applying CFIR to, say, hepatitis C virus treatment. So the thing here in the innovation domain would be HCV medications. There are these new medications now that can pretty much cure you. And so the VA actually did a whole big rollout over the last few years of trying to get any veteran who's infected with that medication. So that's the innovation. The individuals involved are clinicians, leaders, payers, patients, a wide range of individuals, involved in different aspects of this. The inner setting was VA hospitals. The outer setting is the whole VA sort of system, and even non-VA. And then the process is planning for implementation. So that's just a sort of a quick overview of kind of how this language plays out. So kind of go through each domain now and sort of give it a definition and really show you how things have changed in the new system. So the innovation domain, So the CFIR really is now pushing to try to get the folks involved in this in the implementation effort to define the innovation type and the core components, the sort of the pieces that really make it up, and to really try to distinguish between the innovation, something that is intended to continue after the implementation effort, versus the implementation process and strategies, which may end when the implementation effort ends. So just really kind of getting folks involved in the implementation effort to be sharper on that score. So the innovation constructs generally unchanged in CFIR 2.0. So again, it's Rogers evidence, like the extent of it's evidence-based, relative advantage, triability, adaptability, pretty much the standard stuff that was there before. The individuals domain, perception of individuals who have influence and or power over the outcome of implementation efforts, and also specifying their roles and their characteristics. And so that's sort of conceptualizing it that way is different in CFIR 2.0. So there is these two sort of buckets within the individual domain, these roles and these characteristics. So just sort of highlighting, and I'll do this in each domain. So the purple here is what was added in 2.0, and then green here is what was moved from one domain to another. So all the green here, so the leaders, the implementation facilitators, the implementation leads, recipients were moved from various other places and put here in the individuals domain. And then additional roles were added. So the implementation team, the supports, and then the innovation deliverers. So we have a wider range of folks now represented in the individual domain. And then the characteristic subdomain comes out of another framework called COM-B, or this is the Maichi framework that was out a few years ago, that kind of boils behavior down into three domains: capability, motivation, and opportunity, COM-B. And so that replaces a lot of other characteristics that I will show you in a second in the old individuals domain. So the CFIR 1.0 had a variety of constructs about individuals that were seen as kind of confusing and maybe somewhat overlapping. And so these were all removed in favor of the COM-B model, which I think is kind of widely being adopted as a way to characterize behavior and the influences on behavior. So the inner setting, perceptions of the inner setting, it's where the innovation is implemented. It could be a hospital, a school, a city. And as I said before, there could be multiple inner settings, multiple levels within that. And so now we kind of are thinking about breaking the inner setting into two main buckets. One has to do with what is persistent about a setting. So structural characteristics, culture, relational connections, communications, and then what is specific to an implementation, sort of the tension for change around an innovation, its compatibility, relative priority, resources, alignment. So this is, I think, just a helpful way of kind of conceptualizing it. And so some of these were renamed in the sort of orangey beige color here. And then some of these were kind of more built out. So what's bolded here, like structural characteristics and culture, kind of greatly expanded with more content and also available resources. So some of the augmentations, so structural characteristics were defined or provide a lot more information, sort of talking about physical layout, IT, work-related factors, networks and communications has been built out. Culture was, I think, the #1 most confusing characteristics of the CFIR previously, because it just seemed like it was a Rorschach test for anything, you know, that people wanted to put onto it. So there was a lot more effort put into trying to nail this down a little bit more specifically. So talking about things about human equality, recipient culture, deliverer culture, its learning centeredness. So a lot more specific aspects of culture to focus on. And then available resources, kind of just building out what we mean here. So it's, you know, funding, it's space, it's equipment. Again, a little bit more specificity. So, and 3 constructs were moved out, leadership engagement, because that was sort of moved to the individual domain, and the implementation climate and readiness were moved to what's called the CFIR Outcomes Addendum. I don't know if folks have seen that. People are nodding. Okay, so those were moved to that piece. The outer setting, again, where the inner setting, you know, surrounds the inner setting, hospital, school district, estate, multiple outer settings. This got sort of clarified in the new one. And I'll just move to show you. So there were a bunch of constructs that were added. So that's the purple here. So things like critical incidents in the community, or local attitudes and conditions that are in the community or in the hospital, or sort of financing, and then more specifics around pressures, and I'll show that on the next slide. So the pressure was also a kind of a confusing one in CFIR, and so peer pressure was changed to kind of external pressure, and then external pressure was split out into 3 separate buckets. So societal, market forces, and then pressure that comes from having to meet performance benchmarks. So more specifics about that. Policies, external policies and incentives was split out into policies and laws and financing. And then some were renamed, as I mentioned before. And then lastly, the implementation process domain. So this really got a complete overhaul in the new CFIR. So it's the process that includes all the activities and strategies used to implement the innovation. And so what Laura and her team did was they basically went to Eric, and folks probably know what Eric is, and reached for implementation strategies that were pretty much like the most commonly seen, or some of the more impactful implementation strategies, and then added that to the implementation process domain. So things like assessing needs and assessing context before you start an implementation effort, tailoring strategies to your setting, adapting the evidence-based practice to a setting. So those were all added in 2.0. Also, there was a somewhat of an attempt to make the language easier. So executing was renamed to doing. and then engaging was kind of more built out. So really a big change in the implementation process domain. And so opinion leaders, formally appointed implementation leaders, and champions were all moved to the individual's domain. So this is sort of putting it all together into one figure. So, you know, you've got the outer setting, the inner setting, the individuals. This just really shows how these things are nested within each other, and then how you have the implementation process driving the innovation into the inner setting. So it's sort of not the most physically attractive, but we're working on that. And so this is, I think, what we're moving towards. So some other just more general points about CFIR 2.0 is they tried to make the language more consistent. So if you go back to 1.0, there was sometimes the constructs were kind of future oriented, sometimes they were past oriented, they had different tenses. So the language kind of was a little bit all over the place. So now it's the constructs start off with the degree to which X, Y, and Z is in place. So it's very consistent language. Also, CFIR 2.0 is designed to try to amplify the voice of the frontline workers. So there was more of those folks were included in who I think who should be talked to when you're collecting data using CFIR. And so there was a real move to do that. And then something that the team felt very strongly about was a more intentional link to equity. So I'm not, you know, I don't know in Australia, but in the United States, health equity has become, you know, is now a very big issue, and implementation science, I think, and sort of disparity researchers are kind of coming together and seeing implementation science as having a big role to play within trying to promote equity. And so a lot of the building out of the outer setting, for example, taking into account all those local conditions and local resources is a way to try to bring in equity into CFIR and have it, you know, focus on that. And then CFIR 2.0 really, as I mentioned, really pushes users to more sharply define all the domains. And so we just kind of really emphasize that because it basically makes the data collection much more useful. So also, and then I don't know if folks know, but like Laura Damschroeder is retiring. She not 100%. She's sort of a slow motion retirement. And so Dr. Rogel and myself are kind of slowly assuming a responsibility to manage CFIR. So there's a lot of things to do on the to-do list for working on CFIR, and so some things that we're really excited about listed here. So we want to make a new CFIR 2, a new interview guide to go along with CFIR 2.0 and have that be available on the CFIR wiki page. That's in process. Something that we're also working on is creating a survey version of CFIR. CFIR solidly lives within a qualitative data collection method tradition, and we don't want to mess with that. But we do think that there could be a utility to have a CFIR survey as just another tool in the tool bag and give folks working on implementation another option to collect data. And so some colleagues of mine have worked on an early version of this survey. It needs a lot of work. We actually, we think we're going to get a grant from the VA to work on this. And so what we want to do is we want to apply the CFIR qualitative interview and the CFIR survey to the same implementation effort, collect data from both methods, and then see how well they correlate after working on the survey. And then we want to update the CFIR-ERIC matching tool. So we have in this same grant that think we're getting is an effort to bring machine learning to try to then take data that we have built up over the years on CFIR factors and try to then link them to ERIC and have a more robust CFIR-ERIC matching tool. Right now, the tool I think is a good first step, but as soon as you enter like just a few, 3, 4, 5 barriers, the number of strategies, the ERIC strategies it returns to you gets very large very quickly. And so we want to sort of rejigger this tool to kick out a more parsimonious list of ERIC strategies to be more workable for folks. So I can sort of pause here and kind of open it up for discussion. We're very interested in hearing what people think about the new CFIR 2.0 and hearing about what implications you see these changes for your own work.
Thank you so much, Dr. Matt Chinman. That was fantastic. I can attest that health equity is an ongoing issue in Australia, just as it is in the US, possibly in different ways, but we certainly have a lot of inequity in Australia as well. So populations living in rural regions, Indigenous populations, Indigenous communities, people who are refugees or migrants, and people living with disadvantage. There's a lot of inequity, and our system is becoming more inequitable and less affordable. Certainly some data that we've recently published. So similar issues. I was just wondering, as you were talking, and my prerogative to start the discussion, you mentioned the voice of frontline workers, and I think that's really important. That's something that we've always done whenever we've sort of evaluated implementation. But I wondered about the people who span both the inner and the outer context. So you have people who wear multiple hats. How any advice or gems of wisdom about how to deal with that situation?
It's a great question.
Oh, have we lost Matt? Oh my goodness.
No, I think it's just stopped screen sharing.
Oh, has he?
Oh no,
He's still there?
Yeah, can you hear me?
Yes.
Oh, sorry about that.
That's okay.
I'll stop screen sharing because maybe that's also partly what's causing to crash. So I think there's often people who wear multiple hats, and I think it's picking the hat that I think is the most influential. And also we've done in some projects that I've done, we've literally done separate interviews with the same person but wearing different hats, or doing it all at once. But like we basically say, okay, wear this hat for this bunch of questions, and then change, and then okay, now wear a different hat for the same questions, but then repeat it again for a different hat. And so I think, either of those approaches I think can work.
Yeah, it's interesting. And those multi-hatted people can be very, very helpful actually to your implementation efforts. There was a question from Hossai Gul. Hossai, where are you? Do you want to ask your question? Just unmute.
Thanks, Yvonne. Yes. Hi, Matt. I had a question about some of the constructs that were moved out from the inner domain and put into the outcomes. So the readiness and the implementation climate. And I quite like that the readiness one was moved, but can you talk a little bit about the rationale for why the implementation climate was moved right before? So it kind of now feels like we have to do a CFIR assessment of determinants with everything that's in 2.0, which doesn't include implementation climate factors, but then right when you get to the outcomes mapping, you have to. I just felt that it was a really good proximal sort of workable breakdown of immediate culture as it related to implementation. So I wondered if you wanted to expand on that and how what might we like approach that in the future, because now it has human-centeredness and all that, but none of the implementation climate in the 2.0 version.
Yeah, I think that the team felt like, well, there's a couple things. The team felt like it was something that was sort of an outcome in and of itself, that something that would be a target to improve. So for that reason, thinking it could fall under the outcomes addendum. Also, I think it felt like it was pretty confusing and tripped people up a lot. And so it felt like it was kind of addition by subtraction to some extent. But I think for the most part, the climate was seen as something that was mutable, that that could be improved and changed. And that's why it was sort of now thought of as an outcome for the outcomes addendum.
Okay, thanks, Hossai, for the question, and thanks, Matt. Sam, you have a question about versions.
Thanks, Yvonne. Thanks so much, Matt. That was great. I made so many notes. It's just so interesting because a lot of what has been changed are things that I focused on. It's a current project designed using 1.0, and I'm sort of analyzing the results and then going to it's a qualitative analysis where I'll blind code the data and then compare it to the CFIR 1.0. And my question is, to what extent do I bring in 2.0? Because, we used the characteristics of individuals, all 5, or maybe 3 out of the 5 constructs that were removed, and implementation climate, things like that. So yeah, I'm just wondering, to what extent should I bring in 2.0 in like the discussion of the work and, maybe limitations, practical implications, things like that.
Right. I think you bring up a really good point. So I worry about folks like you who are sort of caught in the middle, but like during the change. And so you've basically started under 1.0 and then 2.0 comes out. I mean, honestly, although we are really excited about 2.0, I think if you started with 1.0, I might just see it through and using that, because probably, I don't know, like a lot of the data that you collected were driven from an interview protocol that was driven from 1.0. It might be hard to retrofit and sort of force it into 2.0. Maybe some nods to 2.0, some things that you maybe are an easy fit. That they're, sometimes some of the changes are just a little cosmetic, some name changes, things like that, that wouldn't be so huge. But I still, 1.0 is still pretty good. And so I think maybe rather than making yourself crazy on trying to do that translation now, use 2.0 in your next project. But I mean, you could try to do it. And so something that I can send around is we have a really nice table that goes domain by domain, construct by construct, sort of 1.0 and 2.0, and it just really shows you like directly, this was moved here, and gives some nice definition.
That would be really helpful. But in saying all that, like, thank you for your guidance. And in saying that, I do think that changes like they resonate with me and some of the issues that I encountered when designing quantitative and qualitative aspects of the study. And I think particularly the different types of leaders that have been specified in 2.0 are really helpful in looking at how an intervention gets through the door, at what levels of leadership, and that was a particular thing we were interested in. So I think it's the changes are great. And thank you so much for your guidance.
Oh, sure.
Appreciate it.
Thanks so much.
It's always hard to change midstream, and it's not really advisable, is it?
Yeah,
you may,
I think it's really hard to do that. And there's all sorts of, I'm a clinical psychologist, and I've been on projects where like I use a measure and then like a big revision of that measure comes out during our project, and struggle with trying to translate it. And sometimes it's easier to stick with the person who brought you to the ball. Mm-hmm.
And you may want to consider, the new version of the framework in your discussion, if there's anything that resonates with the new framework.
Yes, that'd be a great idea.
Yeah. Andrea, you had a comment about the outcomes addendum and CFIR 2.0.
Yeah, thanks, Yvonne. That was great, Matt. I found the outcomes addendum really useful in trying to sort of think through how CFIR is used. But I just wondered if you could comment at all about the shifting of, the acceptability, appropriateness, and feasibility to being sort of predictors of CFIR outcomes. I think it impacts a lot on how I distinguish what the innovation is and what the implementation process itself is as well. So I just wondered if you had any comments about that.
Yeah, I think the team felt like it was sort of a long time coming that those were predictors. And it just was more of, I think, a formalization of kind of what folks knew to be true in practice. Those, I don't know if we've seen this in our own work. It's not like there's been like a meta-analysis that has looked at this or anything, but it just seems like those kinds of things are just solidly known as predictors for outcomes. So like you have to have those kind of going in the right direction in order for there to be any chance of implementation success. So I think there's really nothing, maybe more to it than that.
Thanks, Matt. There are no other questions in the chat, but if you have something pressing, please put it in or unmute yourself and speak up. I wonder, Steph, I was about to call upon you because I have written COM-B on my little piece of paper here, and the embedding of the COM-B in the CFIR. What are your thoughts around that? You've used COM-B a lot.
I've used COM-B and I've used CIFIR and TDF. I kind of sort of used all of them. Yeah, no, I was really interested to see the COM-B sort of being brought into the CIFIR revamp. And Matthew, this isn't the question I was going to ask you, but while I've got a chance maybe to have double dip in two questions, I just wondered if you wouldn't mind sharing a little bit more about your reasoning behind why you brought the COM-B in and the value of having it brought in rather than a sort of a standalone theory. Or should I say framework?
Right. I think in our experience in sort of doing like consultations and also in the literature, it just seemed like the characteristics that were there before were kind of unwieldy, and COM-B is just such an elegant sort of way to think about behavior that it just, and also it's becoming increasingly popular also with the TDF, and that it was just a sort of a nice way to think about how to drive individual, how to characterize individual behavior. And so I think, and it's also kind of fitting with its tradition, a CFIR's tradition of being like this meta framework, a framework of frameworks. The ones that were moved out were kind of a hodgepodge of characteristics that didn't, I think, hang together as a unified whole very well. Whereas COM-B is, it is a cohesive whole for how to describe behavior. So I think, and also I think and then we got a lot of comments and feedback about, hey, what about that was part of the feedback that we got from the survey, and also in the literature. People had, there was lots of examples of people using CFIR and then kind of bringing in COM-B on their own. And so we just wanted to make it a formal part.
Thank you, Matt. The other question I just wanted to ask you is, it was great to see that slide of sort of next steps and things that you're planning on doing with this new version. One of them I was interested in, it was around that matching it to the ERIC strategies. And I wondered if you had any kind of timeline on that. I'm thinking very selfishly about projects that I've got up and coming. Is kind of like, should we use version 1 because it's already linked, or should we go for version 2 because they're bound to link it again soon? So I was just curious if you had some sort of insider information.
So we are just, we haven't even started yet. So it's going to be a bit, I think, before a new CFIR ERIC matching tool is released. We submitted a grant. It just got scored. We don't even have a start, we don't even have a start date yet. So it's probably going to be a few years, I would say, before that's ready for prime time.
Thanks, Matt. Yvonne, I can see there's a couple of questions coming in.
Thanks, Steph. So yes, we've got a question from Karen. Karen, would you like to unmute yourself and ask? Oh,
Karen, yes, that's actually my question. Hi, Matt. That was great, really interesting presentation. I was just curious, I think you mentioned promoting equity specifically through the sort of outer settings, but it strikes me that it would run throughout each of those domains. And I just was wondering if, you had a little bit more on what that sort of looks like and how that filters through the various domains.
I didn't quite get all of that, but was it sort of how equity is represented throughout all the domains?
Yes.
Yes. I know it's very broad.
So I think it's in there, say, in the individuals domain, that there's a focus on recipients and all the conditions and all the factors that they face. The inner setting, it's in there on how to what extent a setting is focused on equity or not. And then the process, the process domain, it's in there in terms of to what extent is equity part of the process. So we see these as really important questions to be asking. I think sometimes you need to do a little like tweaking and tailoring to make sure that that language gets in there with CFIR, but it is intended to be sort of represented all throughout all the domains. And so the thing that we are telling folks is that, in addition to just looking at like your innovation and how well it's being implemented, also asking, well, how well is it being implemented across multiple populations? So, the sort of the majority privileged population, as well as, a minority population that, has traditionally not had access to resources and things like that. And so, if you intentionally ask about it, then you get that data that you can then use in terms of informing both the innovation and how equitably it's implemented.
We have one last question, I think, that we can manage in the last 1 or 2 minutes. Katrina Long, would you like to ask your question?
Thanks, Yvonne, and thanks, Matt. So I am currently working with the NAS, and we've had a bit of a go of trying to operationalize the NAS and bringing in how it maps to CFIR and COMBI and some of the implementation frameworks, because I actually find it quite hard to operationalize and to measure. I was just curious if you're aware of, or it's on your radar, any work to look at how the NAS and other implementation frameworks like CFIR might be used together, or how they align as constructs?
I don't think I know of any. I'm sure it has, but I honestly, I don't know. I mean, we haven't done that. So, I mean, if there are efforts out there, we haven't been involved in them. So it's possible that has been done. I know, NAS has a bunch of stuff on de-implementation, and so I think that is a whole area that we're actually trying to get more into and think about how CFIR could be related to de-implementation as well as implementation. And so we actually have a work group that's just starting to pull articles together and see what links that we could make in that regard. But we haven't connected with NAS.
Fantastic. Thank you so much, Matt, and thank you everyone for your very good and insightful questions and a really good discussion. We are out of time. I would just really like to express our thanks to Matt for giving up his Sunday evening. Thank you so much. And if you're ever in Australia, please come to visit. You are very, very welcome. And maybe some of us will go and visit you in Pittsburgh. So thank you so much, everyone. This was a really great discussion, and see you next month.
Thanks so much, everybody. It was great to talk to you. Take care.
Thank you. Bye.